Good afternoon, everybody. Sorry for the slight delay, but we had a session with some delay upstairs. Well, we are in a session with a challenging title, Towards Zero Cardiovascular Events. Looks like a dream, and maybe is a dream, but at least we have to do our best to approach it. And one step, certainly, in this field is getting more accurate blood pressure measurement. No ways. Otherwise, even discussing trials or benefits of treatment, we might be in a position that we might not know exactly what we are talking about. So accuracy is an issue, and this particular symposium will discuss some perspectives in this regard. And let me start then with the first speaker, supposed to be Dr. Bilo, who is going to show us the result of a recent study investigating whether a progressing technology of the inflating cuff might help us increasing the accuracy in blood pressure measurement. Gregos.
Okay, thank you very much. Welcome, everybody. I will try to illustrate to you the results of the study we have performed on the issue of correct cuff positioning and on how the new cuff technology can be of use. The study was supported by the sponsor of this symposium. So this is a slide we all know very well. We know that the higher blood pressure, the higher the cardiovascular risk. No need to spend too much time on that. What I want just to say is that all these data that you see here in this meta-analysis of million people are based on clinic measurements. So this is the instrument that we've been using for, it's been 100 years or so. But it is an instrument which has been recognized worldwide as something extremely useful, extremely valid. You see this slide saying sphygmomanometers don't lie. So this is a very nice phrase, but it is not quite true. I mean, sphygmomanometers, maybe they do not lie, but they do not always tell the full truth because there's a series of problems which can negatively influence the performance of a sphygmomanometer or measurement of blood pressure, especially in a clinical setting. So we can have measurement errors. We know that blood pressure is not a constant, that it is continually varying. So what we measure in our office is not necessarily what the patient is subjected to in his daily life, especially because of the famous white coat reaction, the emotional reactivity to the visit, leading to the overestimation of blood pressure. And when we get into more detail in the sources of possible error in blood pressure measurement, as you can see, there is a long series of possible pitfalls which can lead to really large over or underestimation of blood pressure in individual patients, and thereby to incorrect clinical decision. And I will not be going through them into the detail because you know them very well. I will just focus on one aspect, which is the cuff placement on the arm. So as you know, the cuff of the blood pressure measuring device is supposed to be placed, should be not too tight, not too loose, should be placed about 2 centimeters above the elbow band. And one of the recommendations that appear in various documents is that the center of the bladder should be above the brachial artery, briefly speaking. So it is not mentioned actually in the main ESHSC guidelines, but when you look at the US position paper of the AHA or on the ESH working group recommendations from 2003 or 2007, they all say this. But now when you look at these documents and look at the references for supporting these statements, and you look for clinical studies among these references, the number is 0. So we did some research going back in time to find why, where does the recommendation arise from, and I will talk about it at the end of this presentation. But is it such a large problem? Again, we have very little evidence saying whether people do make this kind of error, if you want to call it error, or not. Basically, no published studies, but we had the access to a consumer study, to a consumer research study, looking in a group of UK and Italian subjects at how many. Here we are talking about the home use of blood pressure devices. How many people deviated from the ideal position of the cuff, that is with the bladder above, center above the brachial artery. And as you can see, about 1 out of 3 users of these devices put the device perfectly, so within plus minus 15 degrees of the correct position, while there was a consistent percentage of about between 10 and 20% who did a very bigger, so 90 degrees or maybe even more. So this does not really seem a negligible factor, considering how many people use home blood pressure devices nowadays. And some time ago, this cuff has been developed, and one of its objectives was to overcome this error by providing a perfect adherence, or possibly perfect adherence of cuff surface to the arm surface. So increasing the contact zone, ensuring a more homogeneous and more adequate distribution of pressure around the arm. This is a preformed semi-rigid cuff. There are many, as you know. It's a wide range cuff, so for the arms between 22 and 42 centimeters. And but obviously, before going to assess whether this cuff really works, because this was the initial objective of this work, we asked ourselves, well, but does it really matter how we place the cuff, since we have no studies to answer this question? So we included this kind of patient, so the wide range of age in sinus rhythm, also in a wide range of arm circumference. Stable clinical conditions. We excluded subjects with significant between arm difference, because we used for the comparison one arm against the other. We tried to include also some subjects with relatively high blood pressure values, but in particular subjects with large arms, in whom we, in a way, expected that this effect might be particularly relevant, and we used the cuff, the Intelli Wrap Cuff, developed together with the M6 Comfort device and validated oscillometric device. This is the procedure of the study. The measurements were performed simultaneously, as I said, on both arms, following the standard recommendations for clinic measurements. We left some time between one measurement and the other. For oscillometric measurements, there were always 2 observers using a binaural stethoscope when there was one oscillometric device, while they divided if we used two auscultatory devices on either arm. One of the arms was always used with auscultatory device placed with a cuff placed correctly, so with the center above brachial artery, and it was always used as a reference. While on the other arm we placed in the first phase auscultatory device, in the second phase oscillometric device, which changed positions. So it was placed either in correct position or rotated by 90 degrees or by 180 degrees. The sequence was done to eliminate any possible biases due to the sequence or to the arm. Selection, so the arm choice was randomized. On the other hand, we couldn't do too many measurements because of the patient's tolerance. This was actually started with the error of the cuff choice. We admit this quite freely. We noticed that the cuff we initially used was actually smaller than was declared by manufacturer. But since we observed with this cuff some interesting things, we decided to analyze a group of subjects in whom this cuff was actually inadequate for the arm circumference. So we call this undercuffing study, and I will show you these results as well. So this was our main study in 55 subjects, as you can see, overall middle-aged, quite large BMI. This was, as I said, because we tended to choose subjects with large arms. So as you can see, average arm circumference was of 32 centimeters, and the entry BP values were relatively low, but as you can see, the range was quite high. So we tried to cover different blood pressure values as far as possible. Now this is the result of the comparison of two auscultatory devices. One was always the reference placed in a correct position, and the other one was always auscultatory placed in a correct position on the other arm. As you can see, no difference here, and also in different position, rotated by 90 degrees laterally, medially, or by 180 degrees. As you can see, all differences are minor, non-significant. Here you can see also the distribution of the differences. There was no systematic change also at the higher blood pressure levels. It was not related to arm circumference. Now, when we get to the subjects in whom the cuff was too small, these are their characteristics, which are quite similar. These subjects were selected in order to have the undercuffing. All of them had arm circumference above 28 centimeters. And here is where you see the difference. While again, this is the reference position, so both cuffs are placed correctly. When you rotate the cuff by 90 degrees laterally or by 180 degrees, there is a clear overestimation of blood pressure on the average above about 4 millimeters mercury. In some cases, it was even larger. Not so in the 90 degrees medial position, interestingly. Again, you can see the distribution. The limits of agreement are clearly wider, and you can see the confirmation. This is for the 180 degrees position, that the mean difference was about 4 millimeters of mercury. When we get to the Intelli Wrap Cuff, as you can see, in this case, to limit the number of measurements, we excluded the 90 degrees medial position, so you can see only 90 degrees lateral, 180 degrees. It fared very well either in correct position or in 90 degrees lateral and 180 degrees position. So we have the confirmation that the cuff provides accurate readings. The mean difference in 180 degrees position was 1.38 millimeters of mercury, non-significant. And here you can see the limits of agreement, somewhat wider than for auscultatory measurement as expected, because we are using a different technique. Now, how to explain these results? Well, when we have a good coverage by the cuff, so this is the perfect condition, we have an even distribution of pressure applied to the arm surface. On the other hand, when we have a cuff which does not ensure a proper coverage of the arm surface, and in addition we rotate it by 180 degrees or so, it is quite clear that the pressure applied on this side, which is not covered by the cuff, is smaller. So we need to apply a larger pressure inside the cuff to ensure the compression of the artery and to obtain the results. So just to finish, I will give you brief results of a second sequence of measurements we performed. We were also interested to see whether the oscillometric device cuff we have been using was comparable to other oscillometric devices with also semi-rigid cuffs, also wide range cuffs, but not specifically designed to address the problem of incorrect positioning. So this is a design. I will not be going into details. Again, we were very careful to eliminate possible biases. And here you can see the results for systolic blood pressure. I will not be naming the devices in this case. As you can see, the position of the cuff had negligible effect for Intelli Wrap Cuff and for comparator A, as we call it. There was some small overestimation of blood pressure with this device, while with the other device that we have been using, there was quite big overestimation. All these are validated, clinically validated devices. There was a quite significant overestimation of systolic blood pressure, and there was an additional overestimation by, again, about 4 millimeters of mercury when the position of the cuff was incorrect. So even for some oscillometric devices with apparently properly sized cuffs, you can introduce an additional error when the position of the cuff is incorrect. These effects were not so clear for diastolic blood pressure. So in conclusion, we noted that incorrect cuff positioning may introduce a systematic overestimation of auscultatory blood pressure values when the cuff is too small in relation to arm circumference, while no overestimation is observed with properly sized cuff. We observed no such overestimation when oscillometric measurements were performed with the Intelli Wrap Cuff. But we found that with another oscillometric device, such an overestimation could occur. And coming back to what I said at the beginning, looking at the various guidelines and the references, when you go back following these references, this is a paper that stands at the background of this all. This is a paper by Ian O'Brien from 1979, probably the first recommendation on blood pressure measurement, which says the center of bladder less than 35 centimeters long must be positioned over the line of the artery. We have asked actually Ian O'Brien about where does it come from. He said, well, it was a bit of a common sense recommendation. So based on this, all the subsequent recommendations were built. And actually, this piece about bladders less than 35 centimeters long was lost in passage. And this probably was an important element of this recommendation. So this was the team working on this study. And I thank you for for listening.
Thank you, Gregos. It's time for a couple of questions. Obviously, this applies to arm sizes ranging up to 42 centimeters of diameter. If you have larger arms or conic shape, the situation might not be solved even by this cuff, I guess.
Yes, well, the extreme obesity is a problem which is very much unsolved as far as I know. There are some cuffs. I know that Paolo Palatini worked on some cuffs specifically designed to accommodate conic arms, and apparently they got some good results out of it. I'm not sure if they are manufactured on the industrial scale. So surely, but 42 centimeters is already a very large arm. So I think the vast majority of the population is covered.
Can be covered, yes. I think another important message to take home from this study is that we may not necessarily rely on cuffs identified as adult type, because they might be different in size in spite of the label, and as you noticed, they might not fit the same range of arm size, which is a very important message, because maybe when you go to the oscillometric devices and you use them in daily practice, but also, for example, to calibrate tonometry to measure central pressure, even if you're using a validated machine but with a different cuff size, you may come up with completely different values that might affect any kind of application. That's something we should probably take care of much more carefully. I don't know whether you agree.
Yeah, absolutely. Well, that's something we ran into at the beginning of this study, and in a way it helped us, but we would rather avoid this kind of surprises. Unfortunately, I think this is particularly relevant for auscultatory devices, which are frequently sold with a so-called standard size cuff. And in this case, sometimes I think it would be important to keep in mind the recommendation which appeared in I think one of the US papers, speaking about 80% coverage of the arm by the bladder. So if we have any doubts, we just need to take a centimeter, measure the bladder, and see if it actually covers the circumference of the arm it declares.